Dr. Sabhyata Gupta from Medanta, the Medicity. I head the department there. And today we are talking about cervical cancer. So let me tell you what it is actually. Cervical cancer means cancer of the mouth of the uterus. And why are we talking about it? Because the incidence of cervical cancer is very high in India. It actually ranks number 1 in rural India and it's number 2 in metro cities. The sad part is that it is a cancer which is absolutely preventable, and despite that the incidence in India is so high. In fact, if we come to the figures, it seems that the annual rate of seeing the new patients in India is something more than 1,20,000, and similarly the death because of cervical cancer, that number crosses more than 60,000 per year. So it's actually a very sad story, especially for a cancer which is preventable. And how do we prevent it? That's the next point. For prevention, we have two things to observe. One is that screening. Screening is something which all those who are not symptomatic for cervical cancer should be reporting for it. And all the ladies who are above, say, 21 years of age should get themselves screened. And in screening, there are various modalities. So whatever suits your pocket and whatever is available in the area wherever you are. So it can be in the form of HPV testing, it can be in the form of pap smear. There are other tests also which are comparatively less costly. And apart in the screening, supposing if you are opting for a screening like pap smear, it should be done once in every 3 years. And all those patients who are symptomatic, they should actually go for the proper testing and treatment. Screening is meant for the ladies who are not symptomatic. So practically all those who think that they are absolutely healthy, even those ladies should get themselves screened. Second point is that how can we prevent it after having done the pap smear. This is one part of it, that you need to get the pap smear done. And the second part is that vaccination is also available now. So all the girls above the age of 9 years can get themselves vaccinated. So it's practically from 9 to 13 years of age. And all those who have missed the opportunity to get the vaccination done can get it done even at a later point in time, say up to 26 years and even later also. This cervical cancer is caused by a virus called human papilloma virus, and the transmission invariably happens from skin to skin, and it is a sexually transmitted disease. Quite a good number of ladies, they get infected with this virus, but they have good immunity to flush this infection out on their own without taking any medicine also. So even if you test positive for HPV, that does not mean that it's a death sentence or it's you're going to have cancer. No. But yes, if you get to know that you have HPV positive smear, then of course it's a good idea to get yourself checked regularly and get the treatment and whatever is advised by your gynecologist. And if you don't flush it out on your own, this infection, then of course over a period of time, it takes very many years actually to progress, and then of course cancer can happen. It is seen that this virus is actually the main causative agent behind cervical cancer. But this is not the sole thing. With this, you need to have certain cofactors, be it in the form of, say, decreased immunity, be it in the form of smoking. If the lady is smoking and is having HPV infection, her chances of getting cervical cancer are much higher. Similarly, if somebody has HIV or somebody having multiple sexual partners, with all these things, they put you in a higher risk category for having cervical cancer. And so I think it's something very important to get yourself screened very regularly. Nowadays, the latest recommendations, they say that if you get the HPV testing done, then the screening is every 5 years, along with the pap smear, of course. Or if you get the pap smear done alone, then it should be once in every 3 years. That is provided your pap smear is normal. And if it's abnormal, you should be consulting your gynecologist for that. So pap smear once in every 3 years. And if you do co-testing with HPV, also HPV testing, then of course it's going to be something like once in every 5 years. It's very important for us to spread the awareness. since it's a preventable cancer and the incidence is very high, if we spread the awareness regarding the screening and vaccination, then we can actually help getting the incidence down. And the other thing is that for the awareness, it should be the right kind of information should reach people. What people do that they search the net, and at times it's not the proper information. It's something very important that all those who are engaged in spreading the awareness should pass on the right information to the public.